Professor Nargis Ahmed, ma'am. Professor, I would request to Professor Nargis Ahmed, Department of Nursing, Alia University, to start the session. So, Professor Nargis Ahmed, you can start now.
Okay, Hassan bhai, thank you so much. Assalamu alaikum, namaskar, and good evening to all of you present here.
Nargis ma'am, we are not audible. শোনা যাচ্ছে না আপনার কথা।
Hassan bhai, ঠিক আছে?
Yes, you can start now.
Okay, thank you, Hassan bhai. Assalamu alaikum, namaskar, and good evening to all of you present here. Today we have joined together for base lecture number 46. The topic is Let's Talk About Dementia. But before starting the session,
Ma'am, it is not audible. Please check.
I don't know, somebody is muting me.
From Nurul Hassan.
I'm from another account, please.
Okay, okay.
That one. So please mute your audio and put off your video during the lecture. Please don't share screen during the lecture session. Please don't see the participants list and do not try to take any screenshot because that creates disturbance during the session. Please note that the whole session, including question and your messages, get recorded. Please submit your feedback after the end of the lecture. A separate feedback link will be provided in the chat box at the end of the lecture. Please do not interrupt the speaker during the lecture. Type your question in the chat box and it will be attended during the question answer session. If you have any problem regarding audio or sound related problem, please write in the chat box. We'll take care of it. So I must repeat the most important, which we face problem every day. I request, please mute your audio and put off your video. Please, all of you will do during lecture session. As well as please don't share your screen during the session. So thank you all for your patience hearing. Today we have our lecture on, I already told, let's talk about dementia. Our esteemed speaker today is Madam Nilanjana Maulik, National Coordinator and Secretary General of ARDSI, Calcutta Chapter. So thank you so much, Madam. We welcome you in our base lecture series. As well as before starting the session, I must tell something about BASE. Bengali Academia for Social Empowerment is a developmental organization registered as a trust by a collective of academicians, scholars, professionals, and other like-minded people working for community and social development. BASE is dedicated in different activities like information and resource sharing, gathering data and preparing database, organizing seminar conferences, working on publication of journal and magazine, encouraging young generation in education by organizing educational camps and career guidance program, providing admission helpline, and so on. During pandemic time and orphan crisis, BASE helped by opening and serving by more than 25 community kitchens, distributing foods and relief material to poor and affected people, distributing study kits to children, especially in North and South 24 Parganas. Since more than a few months, BASE has been organizing multiple insightful online lecture on different aspects for the purpose of disseminating and raising knowledge and awareness for social empowerment. So I request Mr. Hassan Dabak, Senior Research Fellow, Kalyani University, and one of our very own BASE member, to introduce our today's esteemed speaker and chair. Thank you. Over to you, Hassan bhai.
Thank you, Professor Nargis Ahmed, ma'am. So, Assalamu alaikum. Namaskar and good evening to all of you. So, on behalf of Bengali Academia for Social Empowerment, I welcome you all to BASE online lecture series, lecture number 46. Today's topic is very interesting and it is relevant for all of us. Yes, as Professor Nargis Ahmed said, today's topic is let's talk about dementia. I feel honored and privileged to introduce our guest for today's session, Ms. Nilanjana Maulik, speaker of today's lecture session, and Dr. Sheikh Hamadur Rahman, the chair of the session. Ms. Nilanjana Maulik has triple master's degree in sociology, human services, and dementia studies. She is a national awardee, best dementia care worker. Ms. Nilanjana is presently the national coordinator, ARDSI, General Secretary General of ARDSI, Calcutta chapter. She also holds a certificate in successful aging and end of life care from Stanford School of Medicine. She is also an international master practitioner of Spark of Life philosophy from Dementia Care International Australia and a master trainer of dementia care skill from Alzheimer's Disease International London. Ms. Maulik started her work for people with dementia 46 years back, having been trained in dementia care at dementia facility in the USA and providing several years there. She returned to India in the year 1990 to start the work in Kolkata, India. She has been successful in shaping the programs of Kolkata chapter. It is her relentless search to improve the life of persons with dementia and their families and to elevate dementia care in India to that motivates her being. With these few words, I welcome you, ma'am. Next, I would like to introduce our today's chair, Dr. Sheikh Hamadur Rahman. Dr. Rahman is a consultant endocrinologist working at Super Speciality Hospital, Mukondopur EM Bypass, Kolkata. Dr. Rahman did his MD in General Medicine from BHU and DM in Endocrinology from AIMS Delhi. With these few words, I welcome you, sir. I want to express that BASE is indeed honored to have both of you here for the program. Thank you for accepting our invitations. Before we start again, I'm requesting all the participants to put their mic on mute. I would also request that participant to post their queries in the chat box at the end of the session for further interaction. Now, I would hand over this podium to Dr. Rahman to start today's session. Please, sir, over to you.
Thank you so much. At the outset, I am thankful to the organizer that they have arranged such a wonderful session on dementia. And this dementia is a subject, is a topic which we know much less. We as a physician, as a general practitioner, we are not much aware of this. We read much on this dementia, but while in clinical practice, we have our shaky hands while treating patients with dementia, and we refer those patients to a specialist called neurologist. And before this seminar, today morning, I went through little detail in literature regarding this dementia, and what I understood that this is not a job of a single specialist called neurologist. It should be a multidisciplinary approach should be there, as these patients are mostly geriatric population, so they will have many comorbidities like blood pressure, diabetes, thyroid problem, coronary artery disease, stroke, cancer, or maybe cancer survivor. So a multidisciplinary approach, including a general physician, a neurologist, social support group, caregivers support group should be there to take care of these patients. I'll not go into detail of this dementia. We'll listen from our expert, Ms. Maulik. But before that, I'll speak few words about dementia. What we all know, it's an illness of old age. It is characterized by progressive decline in cognitive function, not only memory, although we know this is a problem of memory loss, but this is not only that memory loss that is there. In addition to memory loss, there is problem in the new learning, intelligence, decision making, executive function, language, and so on and so forth. And in the later stages, the patient may not even be able to take care of self, and the illness affects basic personal and social skill. In the past few decades, we have seen the advancement in medical field, and that lead to increased life expectancy and aging of the population. So, as per 2011 census, India is home to 65 million of elderly population aged 65 years or more, constituting a 5.5% of the total population. And the prevalence of dementia in our society is 2.7%. And as the age increases, if we take into account in elderly population more than 80 years of age, almost 20% of the population will be suffering from dementia. And unlike the West, in India, most of the elderly people live with their families, and most patients with dementia are taken care of by family members. But with the increasing elderly population numbers and reducing joint family system in our country, dementia poses a great challenge. And how we can take this challenge and how we can take care of this problem, we would listen from our expert, Ms. Maulik. Over to you, ma'am.
Thank you for that very kind introduction. Good evening to all. Namaskar. On the occasion of World Alzheimer's Month, holding this talk is so important. And on behalf of my organization, the Alzheimer's and Related Disorders Society of India, Calcutta chapter, I am very, very grateful to BASE for having us. And this is nothing but a great opportunity to raise awareness of dementia to a group of people that is working for community and social development. And I believe there are some nursing professionals here too in this audience today. So thank you to you all too. My talk this evening will cover the basics of dementia, the reason why we need to talk about it, and how we can, as the larger community, support those with dementia and their family members. I have been told to speak in both English and Bengali, as have been told to me, so I will try to do that. So let me start with this slide. I will give you some time to read the slide. Just one thing, I cannot see my PPT. Yes. Okay, can we go to the next slide, please? Yeah. So I'm going to give you all some time to go through the slide. Read the slide, please. Okay. Some of you I see laughing, smiling, aren't you? Well, if you are, you join hundreds and thousands of others who casually laugh and share jokes about the experience of dementia. But friends, believe me, it is very, very unfortunate. It's a very difficult journey for those living with it, as well as for their family members who care for them. Dementia is not a condition to laugh it away, nor ignore it. We all are very, very vulnerable to have it. and we must take it all very seriously. I'll tell you the reasons why we need to take this seriously. Can we go to this next slide, please? Here you can see a lot of numbers. In the middle, you can see that's the number, that the statistics for the world globally. At this point of time, there are about 50 million people with dementia around the world. And that number is going to increase to about 131.5 million by 2050. And out of that number, 68% of the population will be in low and middle income country like ours. Every 3 seconds, someone develops dementia in some part of the world. And 2 out of 3 people globally believe that there is very little understanding of dementia in their country. So that's the background. Can we go to the next slide, please? This is the number that we have for India. Currently, India has 5.2 million people with dementia, and that number is going to increase to 16.3 million by 2050. And that's information from the Dementia India report presented by Alzheimer's and Related Disorder Society of India to the government in 2010. Next slide, please. Besides the numbers that I presented, you can see the challenges that we have, not only as a country in India, but all throughout the world. The number one challenge that we have is the limited awareness of dementia as a condition and the stigma that surrounds the disease. And because of this stigma and limited awareness, there is obviously poor diagnosis and treatment options left for people who go through this experience and their family members. And then, of course, there is hardly any resources for people with dementia. That is in terms of financial resources or infrastructure. There are hardly any daycare centers. If I count all over India, there are about 15 for a population of 5.2 million. And there are also very few 24/7 care. And there was a survey done by the Alzheimer's Disease International, which is our parent body in London. And they said that only 62% of healthcare practitioners still think that it is a normal part of aging. So dementia, they believe, is still a normal part of aging. And 50% of people living with dementia feel ignored by healthcare professionals. So that's the background from where we start to understand dementia, provide care and treatment. Next slide, please. So to understand dementia, we have to understand the brain. And we all know that the brain is a fantastic organ. It's a complex one, but an amazing organ in the sense that it helps us to be who we are every moment of our life. It helps us to make sense of whatever is happening around the world. It helps us to remember, see things, hear things, understand it, and control the rest of our body. Next one, please. We also know that the brain has 2 hemispheres, the left and the right. The left controls the right, and the right controls the left. There are about 100 and more billion neurons in the brain that helps us to connect with the signals that happen. So if I want to raise my hand, that's a signal happening inside the brain, and it's helping me to raise my hands. And then there are 4 lobes in the brain, which does the real function every moment of our lives, even when we are asleep. The frontal lobe, which you can see is in red, and if you can see the picture on the right-hand side of the slide, it's the frontal part of the brain. That is in charge of solving problems, the ones that we face daily in our lives. It also helps us to control our temper and use our good manners. Right now, you have been told to switch off your video and your audio. And if you do that, then you definitely are going by the good manners. But a lot of time, and that is actually controlled by the frontal part of your brain. If that is damaged, then you will not be able to function properly. Neither will you be able to control your temper, nor would you be able to use good manners, nor would you be able to solve problems. The parietal lobe, which is just behind the frontal lobe, is in charge of when we pay attention. Right now, you all are paying attention to what I am saying. Some of you are using your senses like smell, touch, or reading and writing. All that is held by the parietal lobe of the brain. And then you have the temporal lobe, which is just below the frontal lobe. That helps us to understand what we hear. So what I'm speaking today, as you hear me and you understand it, that is your temporal lobe helping you. And then comes the occipital lobe, which is just behind the temporal one. And that helps us to make sense of what we see around us. So right now, if you're looking at me, it is helping you to see and understand and make sense of who you are seeing and what you are seeing. So these are the 4 lobes, and they are very critical to the proper functioning of the brain. If there is any damage to any part of this lobes, then that particular function is not going to happen. So you can understand that we do not think much of how our brain functions every moment and how it helps us every moment of our lives. But if you really pay a bit more attention, you will appreciate that the brain needs to be taken care of, because it is the organ that helps us to survive, and it is the organ that helps us to be who we are as a human being. Next slide, please. Now, just like the rest of the body, the brain also sometimes gets sick. And the problems that start when the brain is sick, you will find that you are having difficulty to remember things, information, remember someone's name or the address of your friend. You will have trouble thinking, speaking, seeing what or where things are. Doctors use the word dementia to describe these problems that I mentioned. Next, please. So what is dementia? Now, dementia is not a specific disease. It's a term that we use to describe a host of symptoms, a group of symptoms that is severe, that has to be severe enough to reduce your ability to function, your ability to perform your daily activities, brushing your teeth, going to the toilet, cleaning yourself up, eating. So all the activities that we take for granted are affected when someone starts to develop dementia. So what happens basically is that there are physical changes in the brain. And as you can see in the picture, on the left-hand side is a brain that's normal, and on the right-hand side is the brain of an Alzheimer's person. So the brain has shrunk in size, ছোট্ট হয়ে গেছে ব্রেনটা, শুকিয়ে গেছে, এবং তার মধ্যে যে নার্ভ সেলস গুলো আছে সেগুলো শুকিয়ে প্রায় ফাঁকা হয়ে গেছে ব্রেনটা. So basically what happens is the nerve cell starts to die, and hence the shrinkage of the brain. Next slide, please. Now, these are the 10 warning signs that we share with everyone, and everyone needs to keep a note of these 10 warning signs. Now, if I go through these 10 warning signs, many of you here today would feel that, oh my God, I think I have dementia. Because a lot of these symptoms you can relate to very well. For example, memory loss, forgetfulness, if I may put it simply. Now, memory loss or forgetfulness in dementia is mainly short-term memory loss. So basically it is, আজকে সকালে কি খেয়েছি breakfast, মনে পড়ছে না. That is what happens for a person with dementia. আমাদের মনে হয় না সেরকম হয়. অনেক সময় if we are really stressed out, maybe সেটা হয়ে থাকে, কিন্তু জেনারেলি এরকম হয় না. আমাদের হয়তো গতকাল মা যেন কি বলেছিল সেটা মনে পড়ছে না, কাজের কথা, সেটা হয়তো হতে পারে. So the memory loss in dementia is short term. The long term memory is pretty much there, and as the disease progresses, I'm sorry, I see that a lot of people tell me that I should speak in English. So I think I should. I'm sorry, I was told to mix Bengali and English, and that's the reason why I started to speak in Bengali. I will continue in English. So the memory loss that we see in dementia, as I said, is short term. And the long-term memory is still very much there. But as the disease progresses, the long-term memory is also affected. The second problem that we see, a warning sign for someone who is developing dementia, is difficulty performing familiar tasks, meaning brushing your teeth, taking a bath, finishing your meal. These are your daily activities. And when you have difficulty in performing those, that is when you should be alarmed. Third one is problem with language. Right now, I'm sharing a lot of information with you. If I had dementia, I would have problem explaining and giving this lecture, because the part of the brain that helps us to bring together words and form a sentence and express it, if that is affected in a person with dementia, that person will have difficulty with language. Number 4 is disorientation to time and place, meaning what time it is right now, or where am I right now. This sense of where that person is and what is the time, for a person with dementia, that starts becoming difficult. Then we have another sign which says poor or decreased judgment, meaning the person will have difficulty to judge maybe the environment where that person is, whether it's a hot or a chilly day, whether it's raining outside and I should take an umbrella. So these decision-making power is decreased in a person with dementia. Number 6 is problems keeping track of things. These sound so much like us. We keep having these problems, but for a person with dementia, it gets worse and worse and worse. Number 7 is misplacing things. A lot of us also misplace things and we cannot find them and we're looking for it. Sometimes we have our eyeglasses up on our head and we're looking for it. These things happen often. But for a person with dementia, misplacing things go to another level, meaning that they will probably keep their glasses inside the refrigerator. I am pretty much sure that none of you would do that. So misplacing things in a person with dementia takes another form. They do misplace things, but they keep it in such places that even, it's just impossible to find. And then you have changes in mood and behavior. All of us also have these changes in our lives, and situations create us. to have, a bad mood or, not so good behavior. But for a person with dementia, this change of mood and behavior continues, and it disrupts their daily activities. And then you have trouble with images and spatial relationships. So for a person with dementia, when they see an image, it's difficult for them to make sense of what they are seeing. Or they would have difficulty in maneuvering their spatial relationship, meaning how far is the table? Can I get up from here and walk across the table without hitting myself? So that kind of understanding is affected in a person with dementia. Lastly, what you see is withdrawal from work or social activities. A lot of people with dementia slowly start to withdraw from work or activities that they like doing, their hobbies, meeting friends, watching a movie, things that they loved doing earlier starts to decrease for them. Next slide, please. Now, there are many causes for developing dementia. We can divide it between two groups. One is under the reversible causes. The ones that are reversible include brain injury, thyroid problems, vitamin B12 deficiency, and there are a few others. Now, these conditions, if treated, the dementia symptoms that one would develop would go away. So these are reversible types, meaning it can be reversed to its earlier phase. But what we are talking today is about the irreversible types. That's the scariest part, the ones that cannot be reversed, even without the medications that we have right now anywhere in the world. And one of the most common form of the irreversible type of dementia is Alzheimer's disease. And what we see in a person with Alzheimer's disease is significant memory loss. That's the most significant sign in a person living with Alzheimer's disease. If we go to vascular dementia, which is another form of dementia, there memory loss is not that significant. It's other symptoms like repeated, talking, change of personality. These are some of the symptoms that we see in a person who has vascular dementia. In India, we see more people with vascular dementia than Alzheimer's disease. And that's the reason why we have a lot of people coming to us and complaining that they are going through symptoms that are getting worse and worse. The reason again is that in India, a lot of people are hypertensive, and in vascular dementia, what happens is the oxygen does not reach the brain, and if it does not reach the brain, then there are little small tiny strokes happening inside the brain, and wherever those little strokes happen in the brain, that part of the brain is damaged, and that is vascular dementia. Vascular dementia is not reversible at all. As I said, these are under the irreversible types of dementia. Dementia with Lewy body is another type of dementia where, again, the symptoms and signs that we see are hallucinations, delusions, problems with gait, mobility, not necessarily memory loss to start with. But as the disease progresses, people with Lewy body or vascular dementia will also show signs of memory loss. And then we have frontotemporal dementia, which is one of the most difficult dementias to deal with because, as I said, the frontal part of the brain that controls our temper, that controls our behavior is damaged. And therefore, family members who have a person with frontotemporal dementia faces a lot of challenges because the behavior of the person changes. The person tries to do says things that are absolutely not acceptable. Hence, it becomes a huge struggle for family members to take care of a person with frontotemporal dementia. And then there are a lot of other types of irreversible types, which it's not possible for me to go through each of them today. But you should clearly understand that if you show signs of dementia, then you should not come to a conclusion that it is irreversible. So that is the reason why I recommend that you go to a specialist or your GP, a general physician, who will rule out the possible causes of that dementia, whether it is due to the reversible types or whether it is the irreversible types. So the next slide, please. These are some facts that we need to know. Dementia can affect anybody across the society, across the community, rich or poor, men or women, whether you are literate or illiterate, it can affect anyone. It is not infectious, just like the coronavirus that we have right now. So it is not going to spread from person to person. And dementia is not a normal part of aging. So by saying that, I mean, it does not mean that as you age, you will develop dementia. There are a lot of 96 years old and 86 years old that have sharp memory and sharp ability to function and still participate in life. So it is not a normal part of aging. Dementia is also not a mental illness. It is a mental health condition. It affects the mental health of the person, but it is not a mental illness. So these are facts that we have to be very clear about. The next one, please. Here are again some points to remember. Dementia, the irreversible types, progresses in 3 stages. The mild stage, where it's just like you and me, forgetting, misplacing things, not remembering, problems with mood and behavior, very natural. A lot of us go through this. It's the mild stage when you think nothing's wrong with me. And that's also with a person who is developing irreversible dementia. And then comes the moderate stage where people have problem that affects their daily activities. So if they go to a grocery, if they are told to bring 5 things, they come back with 2 things entirely different. And they lose money, they have difficulty managing their finances. So it becomes more pronounced in the moderate stage, and that's when the person falters, and that's when the person starts to be taken care of. Not necessarily 24 hours, but definitely a large part of their day. And then comes the severe stage. This is a stage when the person is absolutely 24 hours, 24/7, completely dependent on another individual to be taken care of. So if your brain stops functioning, if your brain is not working, then you will not be able to move your hands, move your eyes, your mouth, you won't be able to walk. Unfortunately, we don't think much of what the brain does for us every moment of our lives. But it's only when a person is affected with dementia, the irreversible types, that's when you realize what the brain does for us every day. And so we need to really, really take care of it. This condition can be chronic. It can last from anywhere between 8 to 12 years or sometimes more. I have had patients that have lived 16, 17, 18 years or more. And that basically depends on the type of dementia the person has, and also if the person has any other comorbid conditions, whether that person is hypertensive, whether that person is diabetic, or has other lifestyle diseases. That also contributes to the number of years the person lives. Next slide, please. Now, that's very, not a very elaborate description of the diagnosis, but this is all I could manage in one slide. So when you show signs of forgetfulness, when you show signs of trouble remembering things, misplacing things, so you go to a doctor, and the doctor, what they do, the first thing is to do a blood test that will rule out the reversible types. So if you have any of those reversible types of dementias, then the doctor is going to treat those, and your dementia signs are going to go away. You're going to be fine. But if the reversible types are not the cause for your dementia signs, then the doctor is going to do a psychiatric evaluation where they will see whether you have any depressive symptoms or any other mental health condition which is contributing to the symptoms. Once that is done, then the doctor will do some cognitive and neuropsychological tests that will basically test your memory, your orientation, your reasoning power, your judgment power, language skills, and your attention. All this will be tested through various ways, mainly through question and answers. There are very tests that neurologists and psychiatrists and psychologists do. And then there will be a neurological examination of your movement, your senses, your balance, reflexes. And lastly, the doctor would go for a CT or an MRI scan that will give a picture of where the brain damage has happened and to what extent. So this process can take anywhere between 2 to 3 months, sometimes longer. So just remember that no diagnosis of dementia happens in a day. It takes a longer time than that. And you cannot really, diagnose dementia in just a few hours. So please do keep that in mind. Next slide, please. As far as the treatment of the irreversible types of dementia is concerned, there's no cure for all the types of dementias that I discussed. At this point of time, this is the situation anywhere in the world. There are few medications, 2 or 3 of them, that are used to temporarily improve the symptoms, but they do not cure the condition. So in this situation where there is no cure and there are very few medications, the only way out to treat people with dementia is through various non-pharmacological, non-medical therapies. And these therapies are the best way out, the best bet for the family caregivers as well as professionals who take care of people with dementia. I will definitely go into a bit more details in my next few slides where I will be talking about these therapies. But let me get into the risk factors because we all want to know what are the risk factors for developing these irreversible types. Of course, age is something that's not in our hand. Every year we are going to get older and older, and as you get old, your chances of developing dementia increases. Not necessarily that you will have it, but your chances increases. Family genetics. If you have someone in the family who has dementia, your chances of developing it increase it, but not necessarily that you will have it. Gender. Between the age group of 65 to 75, we see more men with this condition, but after the age of 75, it's more women who we see with this condition. The only reason is that women live longer than men. And hence we see in that age group between 75 to 85 or more, it's more women with dementia. Lifestyle diseases, being hypertensive, being diabetic, obesity, high cholesterol, these are all reasons why you could develop dementia. Smoking and drinking. If you are a heavy smoker, you're a heavy drinker, then your risk of developing dementia increases a lot. Next slide, please. This is something that all of us want to know, which is how can I prevent myself from developing dementia? Now, what we say is that whatever the doctor tells you to do for your heart, you would do the same for your brain. Unfortunately, all of us are very much worried about whatever happens, anything under our neck, your legs, your back. You're so worried about all parts of your body except your brain. You never take care of this. So the way you can take care of your brain is the way you take care of your heart. So eating a healthy, balanced diet, maintaining a healthy weight, exercising regularly. The World Health Organization recommends about 10,000 steps a day, and that is for any age. And of course, besides the exercises, the other thing that is recommended is that you cut down your alcohol and smoking, which is very much a risk factor, as I mentioned. The last 2 points are the most important points for reducing the risk of dementia, and that is to keep yourself mentally active and to stay socially engaged. Now, when I say keeping yourself mentally active, I mean not necessarily watching television 5 hours a day, or something that does not stimulate your brain. You have to do activities that will stimulate your brain. And when I say a stimulation, I mean some activities that are new to you, something that you are learning. So say, for example, when you were very young, you wanted to learn how to play an instrument, but you did not get time because of your studies or your work. But now that you have time, or not necessarily, this is also for people younger, you need to learn something new, and it could be done through your daily activities. Maybe you're going to your college every day and you're taking the same bus or the same route every day. So it's recommended sometimes that you take a different route, get lost, stimulate your brain and find your way out. That's called stimulation. That's called being mentally active. And that's the way you keep yourself mentally active. Stay socially engaged, meaning you have to be involved in social activities, whether it's through your club, volunteering, whether through your friends, family. And this, in fact, the last point is the most important way out if you want to be wanting to prevent having dementia. So stay socially engaged, be with your friends, whether it's online right now because of the pandemic, we are all online. So that's how you take care of your brain. Next slide, please. Now, let me come to taking care of someone who has developed dementia. I have these 3 basic points, and this 3 points basically sums up the approach to caregiving in dementia. And this is the essence of dementia care. There is no magic formula. There is no magic formula that can be used to take care of someone with dementia. And there is no rational process, no prescribed rules to follow. And caregivers will have to develop their skills to match the needs of the person with dementia, not the way around. The person with dementia cannot match your brilliant mind. It is you who will have to use your brilliant mind to match the skills of the person, whatever exists in that person with dementia. Now, why? Why is that there is no magic formula in dementia care? Why is it that you cannot follow a prescribed format in caring for a person with dementia? Next slide, please. The reason why you cannot follow a prescribed method in caring for a person with dementia is because if you have met one person with dementia, you have met only one person with dementia. Because each individual talks, acts, remembers, behaves differently, irrespective of whatever stage they are in or who they are. Now, in this audience, we have so many of us, each with our own set of behaviors, each with our own set of likes and dislikes. If I had one rule for each of you and treated you the same way, it would not work. That's the same for caring for a person with dementia. Next slide, please. Another reason why a magic formula doesn't work, or why a prescribed set of rules does not work, is because you would have a person with dementia who will come to you and call you your sister, her sister. So we have this lady in our daycare center who would come and tell you, my sister, how are you today? And then next day she would come and say, how are you, my friend? Maybe day after tomorrow, she would call you her daughter, or you may be her mom. The same person can behave and treat you differently. Now, if you have one rule for her, it is not going to work. So when she calls you her sister, you have to be her sister and caregive her in that manner. And when she calls you her mother, then you have to act like her mother and be her mother and treat her like one. Next slide, please. For this to happen, for you to develop those skills to take care of a person with dementia effectively, you have to have certain skills. Without those skills, you cannot care effectively. And those skills are, number one, being curious. You have to be curious. If you're not curious, and you have to have the curiosity of a detective, just like a detective who will see who comes in and goes, what is happening, what is the environment. So you have to every moment be curious in your mind and look out for information that the person is presenting. The second one is you have to be creative. Just like I told you that you can have this lady who changes her mind when she sees you every day. One day you are her sister, the other day you are her mother. If you are not creative as a caregiver, then you will not be able to handle her. So when she comes to you as a sister, you may share secrets with her and act like a sister. When she calls you her mother, then you have to be that mother who can be a little more strict and tell her to do things. So unless and until you're creative in your mind and your body and your spirit as a caregiver, you would not be effective. Caring is, of course, universal. You have to care well. And common sense. In my 26 years of working for people with dementia, what I see most lacking in caregivers is common sense. If they had common sense, they could well do so many things. But thinking on their feet and not reacting but responding to the situation is what is needed of a good caregiver. And that is something that you have to keep in mind. Next slide, please. Now, I was talking about the caregiving approaches, and these are the three most important caregiving approaches that we as caregivers, professional caregivers, or as a family caregiver can use to manage all the difficult situations that we face every day. Reality orientation. This works in the very early stage of the condition, where the person can still read and write and analyze the information that you are presenting to the person. So reality orientation would be, what is the time and what is the date today and what's the month of the year. So you can show a calendar and distract and bring the attention of the person to the oriented activity that you're trying to do. Validation of feelings is where it comes to the next stage, where the person is no more able to reason and judge and understand what you're saying and able to communicate well. That is when you have to read the emotions behind what the person says rather than the content of what that person is saying. So if the person says, I want to go home, my mother is waiting for me, and if that person is 80 years old and the mother of that person is long dead, you as a caregiver cannot afford to say that, what are you talking about? Your mother is dead long back. How can your mother wait for you at home? That's the usual reaction we have when a person with dementia says that to us. If you are a good caregiver, you would be creative, and your response, not reaction to that situation would be, oh really? So your mom's waiting for you at home. What is she going to cook for you today? Why don't you share the recipes of your mother, your favorite recipes of your mother? So what you could do is, by distracting the person and changing the perspective, really focusing on the emotion. So when we talk about our mothers and we talk about our home, we're not talking about the physical thing. We are talking about the emotion behind that. The house brings in a lot of memories for us. Mother, that word brings in a lot of security for us. And so when a person with dementia utters those words, home and mother, all they're looking for is security. All they're looking for is some kind of security from the difficult world that they are living right at that point of time. And the third approach that you can take is a reminiscence. And this is a wonderful approach that any caregiver can take. All you need to do is go and find out the life history of that person, what that person loved to do, what was their favorite activity, who were the people that mattered to that person. Now, these are the information you need to collect and use them when you care for the person with dementia. I remember a lady who had once come to me and said that her husband had frontotemporal dementia and was, a huge issue at home. And the one thing she was sad about that was that he forgot when they got married and that they were married at all. And so she said, I wish he could remember that we were married. And so what we did one day was we created a wedding environment in our daycare center where everybody was dressed in their wedding attire. There was Shanai playing, and there were food and flowers, Rajanigandha. And we had invited their family members and friends. All the persons with dementia came with their family members and friends. And we were discussing about the wedding day and really doing the rituals, when suddenly that gentleman got up, went to his sister-in-law who was sitting at the corner right beside his wife, looked at her in the face and said, hey, do you remember the letter that I gave you that morning to give to my to-be wife? Did you give it to her? For a second, his wife was stunned. This was one bit of information that only she and her sister-in-law knew, that on the wedding day, he had sent her a letter, a note written by hand through, the sister-in-law. And that little trigger gave so much of joy to the wife. And she said, I don't need anything more. I've got whatever I needed. So reminiscence is a beautiful activity, and all caregivers could try it in any situation. You could pick up any objects at your house and reminiscence about it. And you can spend hours with a person with dementia. Unfortunately, what we do is we focus on the abilities that they have lost. We do not focus on abilities that they still have. And that is what we need to do as caregivers. Next slide, please. So what I would like to ask from you is your support in raising awareness, just the way I did this day. we would like you to come and volunteer for us. We need a lot of volunteers, and we do have beautiful volunteers at our center. You know, they come at the daycare center, they spend time with the person with dementia, and you know, they come with no baggage. They come with no expectation. All they come there for is to have a good time. And we want a lot of volunteers to come and spend time at our daycare. We also want you to refer anyone who is showing signs and symptoms of dementia, because we could help that person to chalk out a care plan and have a quality life ahead. The other thing, you know, as an NGO and as a secretary of an organization, I do not miss the opportunity to share that we always are short of funds, and we would love for you to fundraise if it's possible for you. If you are interested, you could always get in touch with us and help us fundraise for the programs that we have. I wanted to, the next one, please, the next slide. I wanted to introduce to you as I end our organization. It's the Alzheimer's and Related Disorders Society of India, Calcutta chapter. It was started in 1999 when I had just returned from the US, and I got in touch with Mrs. Shefali Chaudhary, who was 83 years old then, and she had a daughter who had Alzheimer's disease. And she wanted that people like her should not be struggling daily to take care of their loved one. And that's how we started this organization in 99. And it's a registered organization in Bengal. We extend care and support, and our chapter was awarded the best chapter twice nationally. So I guess we do some good work. Next slide, please. I'll just end my presentation with this slide where I will give you a glimpse of what we do as an organization. So if you are showing signs or symptoms of dementia, you could get in touch with us. We will do a memory screening, a memory test by a psychologist. Our neurologists are also in the panel. You would get the treatment and diagnosis at our memory clinic. We do awareness programs, which is just the way I did today. Talking about dementia, raising awareness. We have training programs for those who are interested in being a professional dementia caregiver. We also train family members in caring for their loved ones daily. We have publications, Bengali as well as English, that could help you to learn more about this condition and also take care. We have an outreach clinic in Chandanagar. We felt that we were too city-centric. We wanted to get out of the city and help people in the rural areas, because we believe that dementia was still happening there and we were not reaching them. So we started an outreach clinic in Chandanagar, and we run a clinic every Sunday there. We have carer support meetings where caregivers who come to our organization, they sit and discuss their journeys, and they are very helpful for another person who is going through the same journey. Sharing is caring, and that's what they do at the carer support meets. We also do have, what should I say, home companionship program where our trained caregivers go and perform activity-based care for people with dementia at their home setting. We also have a daycare center which is open 6 days a week. Right now it's open, but we really don't have anyone coming in because of the situation that we are in. But we hope to soon open it and cater to people who need it. So this is Monday to Saturday, 10 to 4. We are open, and it's a place that is there for having fun, nothing else. We have a lot of fun when we are at the daycare center. There's no right and wrong answer inside that building of ours. Whatever you say, whatever you do is the right thing. And that's the kind of non-threatening environment we present in the daycare center. And our hope is that we will start a 24/7 care soon, because I believe there's a huge need. If not a 24/7 care, long term, at least a respite care center that could provide respite to caregivers for a shorter period of time. So that's all I had to say for today. I'm open to taking questions. Please go ahead and shoot. Thank you. Thank you once again, Base, for having me and giving me this wonderful opportunity to talk.
Thank you so much, ma'am. Thanks for your enlightening talk on dementia. You nicely explained the presentation, its causes, the reversible causes, irreversible causes, and lastly, what I enjoyed your approaches towards the case of dementia, particularly the non-pharmacological approaches. As a physician, I know the medication and role of medications is limited in dementia. Only very few medications are there to treat dementia, and the results are not rewarding that much. It's the non-pharmacological approach and the support from the family, support from the caregivers, and support from the groups like you, ARDSI, that will take care of the subjects with dementia. And one more thing I want to share, during my UG and PG years when we read dementia, we as a medico, we took this topic as a boarding topic. Don't take it otherwise. I am sharing my own views, and it appeared to us, not only me, my all colleagues, all friends, it appeared it's a boring topic, it's not that much interesting. But today, after hearing your lecture, it appeared me it's not boring. It's we can work with these patients, and rather we should take care of our elderly. If we don't take care, who will take care? So today you made a change of the views towards dementia, at least in me, and I enjoyed this lecture a lot. And before handing over the session to the organizer, I want to give one answer to the question that is related to my topic. I being a thyroid specialist, hormone specialist, endocrinologist, there was a question: can thyroid lead to dementia in young people? The answer is yes, definitely. There are two types of thyroid problem in the young generation. If it is a congenital hypothyroid, it can cause cretinism and severe neurological dysfunction. That is not dementia. But if it is primary hypothyroidism in a young child which is not treated properly, that can lead to features like dementia. And the good part is that if we can detect these cases early, the problem is reversible. Now I am handing over the session to the organizer to discuss the questions with the speakers. Thank you once again.
Thank you.
Yes,
Okay, Abid, question.
Yeah. First question to ma'am is, the mechanism of dementia is almost clear to the scientists, such as responsible proteins are BACE1 and TAU. Why then still no drugs available in the market?
That's a heavy question for me. I wish I had the answer to that question. There are hundreds and thousands of scientists all over the world spending billions of dollars to find answer to that question. I guess it is a matter of time. Just like cancer, we don't have an answer to it yet for so many years. AIDS, we don't still have an answer to it. It's the same with these irreversible types of dementias. As I said, we are hopeful that in coming years we will definitely have an answer. If Dr. Hassan, would you like to answer that? I mean, support. Do you have anything else to say to that?
Regarding this question, there is no definite answer of this question, because the disease is a complex disease, and it's many types of disease that present with dementia, and the most common type of disease is Alzheimer's disease, and that's a senile disorder. In that disorder, what happens, the proteins get entangled and get deposited within the cell, and that has no definite solution. We have no definite solution to remove those entangled proteins. Regarding other types of dementia, regarding vascular dementia, that's again an aging problem and related to atherosclerosis. So again, treatment is also limited. What we can do, we can reduce the risk factors. We can treat the diabetes, we can treat blood pressure problem, we can reduce the cholesterol level. But again, definitely there is no definite solution for different types of dementia. Definitely we will wait for a definite solution. People are trying different research is going on. So let's see, we are hopeful for a possible solution in near future. Thanks.
Yep.
Okay, next question is what happens in vascular dementia? Is vascular dementia reversible?
Vascular dementia is not reversible. It's an irreversible type of dementia. And what happens, as I mentioned in my talk, is that the oxygen does not reach the brain. And because it does not reach the brain, there are minute strokes that occurs inside the brain. And because of those minute strokes, the multi-infarcts inside the brain, the damaged area is, starts malfunctioning, and hence you are not able to function the way you would do before those strokes. So it is an irreversible type of dementia. Once it sets in, all those damages that happen due to strokes cannot be reversed.
Okay, next question is does severe dementia last between 8 to 12 years?
As I said, that every person is different. Someone with diabetes can, if that person is, going through the treatment well, is exercising, is taking care, can live up till 90 years with being diabetic. So it depends on the person. Here, if that person has no more comorbid conditions besides dementia, then that person can live with dementia for a longer time than somebody who has other comorbid conditions. So it totally depends on the person, their medical history, or their other comorbid conditions. So you cannot pinpoint and say that this are so on an average we see 8 to 12 years is what a person with dementia goes through.
Okay, next question is what is the purpose of playing along with a dementia patient's reality? How does it help them and their condition?
Once again, please, I lost you.
Rohan Meshram has asked this question. What is the purpose of playing along with dementia patient's reality within quotes? How does it help them and their condition?
Right. Very, very interesting question. Playing along with their reality only helps the situation. We in our world of dementia caregiving, we say white lies. We use these white lies to keep the person in their reality. Say for example, as I gave the example of this gentleman who was 83 years old and who wanted to go home and be with his mother and have lunch there. Now he was in our daycare center at that point of time, and we could not send him home. There was no way he could go home. So we had to play with his reality of wanting to go to his mother and his mother waiting for lunch. So what we did is sometimes talk to him about his mother and the recipes that his mother cooked for him, or sometimes what we would do is from another room have someone call him over the phone, and we would have another carer hold the phone and act like a mother and say, can you be there? I am having this difficulty at home. I'll come and pick you up in some time. And so what happens is that you validate their sense of being, you validate their emotions. And as I said, people with dementia are looking for security. People with dementia are looking for an environment that they can feel comfortable with. And so if you are playing with their reality, there is no harm. All it does is good. Now, of course, if it is something that is demeaning them, when you are playing with their reality and you're demeaning them, or you're laughing it away, or you're trying to put them down, then that's definitely not accepted. But other than that, you could go hours. I remember, something like that lady thinking that she's a 12-year-old and she needs to comb her hair and have somebody do that for her. And you can sit with her, comb her hair, and sing songs when she was that 12 years old, and keep her happily engaged in that activity for hours. Now yours is a choice. Would you like to do that, play with her reality, or would you like to say, you know what, you are not 12 years old, you are 80 years old and you have to behave like one? So this is your choice, what you would want to do.
Okay, next question is, if hypnosis helps in dementia, what about other forms of psychotherapy?
I'm sorry, this is something that I will not be able to answer. I've never faced this kind of situation, so I am sorry, I am not in a position to answer this. Hypnosis helps in dementia. I'm not aware. I've not done that.
A psychiatrist will help. A psychiatrist.
That's true. We don't try all this hypnosis thing.
Okay, I would like Soma Maulik to ask the question directly to chair as well as the speaker.
Thank you for permitting me to ask directly. I am 58 and I have started, because of stress and many things, as being a caregiver for a number of years. I have also started, and have become very disorganized. I have started forgetting things. Since it's a genetic thing, should I go for some, for tests connected to brain or MRI? Should I do that? Because I also know from series of your lectures, from your precious lectures, that pathologization or medicalization of this mental health condition will also not help. Thank you.
Thank you, Shoma. Thank you, Shoma Maulik, for your question. Knowing you, I really do not suggest that you go for an MRI scan. You have the answer yourself, that you are stressed out, you have a job to maintain, you have a family to look after, and you have your mother who is going through the experience of dementia to take care of. And this is not an easy journey. It's only those who care for a person with dementia and handling and juggling so many responsibilities know what the pressure is and what the situation is daily. So please understand that what you are going through is stress, and stress is one of the most common reasons why people go to a memory specialist, because they start forgetting things. So rather than going for an MRI scan, I would really suggest that you do practice meditation if if that is something that suits you. I mean, if somebody told me that go and meditate, I wouldn't be able to do it, because I cannot practice meditation. It's a very difficult thing for me. I would rather listen to music. That's meditation for me. So depending on what gives you calmness, what gives you comfort, if just going to your friends and talking about it and sharing about it gives you comfort, then that's your way out of this situation. Give yourself time, be a little relaxed. You cannot, as I say, you cannot be a perfect caregiver, and that's a myth. Nobody can be a perfect caregiver, whether you are a mother, whether you are a father, nobody can be a perfect one. So give yourself that flexibility and take one thing at a time. You cannot take 10 tasks and feel that, oh my God, I'm not able to achieve any of them. So take one task at a time, and you achieve one, give yourself a pat at the back, and go for the second one. So I'm sure you will overcome this.
Okay, Ranodesh Chaudhary has a question. caregivers face the challenges when the person with dementia refuses to food or medicine. Obviously, applying force will not be the option. Is there any specific step that should be followed?
Right. These are, the real issues that caregivers face, and this is where the support is needed. So, in terms of food, unfortunately, what I've seen is that as soon as a person, whether it's a person with dementia or somebody with other illness, we treat the person like a sick person and start taking decisions on behalf of that person. We do not let that person decide. And so what happens is that you decide when the person should eat, you decide what that person should eat, you decide that the person should eat all by himself or herself. So many a times what I've seen is that the person is sitting all alone and there's the caregiver standing beside and making sure that the person finishes the food in a certain time, is not wasting, is eating exactly the sequential way that is thought of for a so-called a person who has the right kind of brain, that you start with the dal and the rice and then the sabji and then the mutton or the fish and then at the end the sweets. Now if the person with dementia starts with the sweets, you are absolutely unhappy, you are angry, and you start throwing things away, moving things away, and tell the person you cannot eat like this, you have to start with the rice and dal and sabji. So most of the time it is we as caregivers who force the person to work the way we want. So if you want that person to eat well, enjoy the meal, you see, enjoying meal is one of the most personal activities, just like taking a bath is. And these are enjoyable activities. And if you are forcing and making it scary for that person, then forget about eating. They do not want to do those activities. So what I recommend is making the environment relaxed and have someone sit with the person and eat also. Most of the time, people with dementia are eating alone at home and the caregiver is standing and instructing. Rather than that, have the caregiver sit and eat together. So eating is, imagine yourself, if you are eating alone and you have somebody sitting right in front of you and making sure that you're finishing your meal, you're not going to enjoy it. So what is recommended is that you have somebody sitting and enjoying the meal together, and I can vouch that the person is going to enjoy the meal. As far as the medicine is concerned, yes, people with dementia have difficulty in taking medicine. So there are several techniques that can be used to give them the medicine. Either you, if they're absolutely refusing to take it through, just by itself, you have to put it inside the food or their favorite drink. Of course, after recommendation from the doctor that it is okay to break the medicine, cut it in half and give. Sometimes also, if you talk sense to the person with dementia, unfortunately what we do is we don't talk, we don't share, we don't communicate. All we do is bring the medicine, put it in their hand and say, okay, eat it, take it. I can look at it and say, what the hell, I don't want to, what is this, what is wrong with me? I don't want, because that person doesn't remember that person has to have medication. So what you need to do is say that, the doctor of yours has asked me to give this medicine for you, and this is going to help you in doing your activities that you do, in the problems that you're having. Would you mind taking the medicine? These are the things that we never do. There is no permission taken, no conversation that happens. All we expect that person to do is listen to and follow our instruction. That doesn't happen. And this is the challenge of a caregiver, that you take up the challenge and prove that you can achieve if you do it the right way. I hope I've answered your question, Mr. Chaudhary.
Yes, ma'am. Yes, ma'am. Very rightly you have said. Thank you.
Thank you.
Okay, I have a personal question. My question is, there is a particular diet for epileptic children, which is we know as keto diet. So, do you think that this kind of diet is beneficial for dementia people?
I have no diet recommended for people with dementia. I encourage them to have everything, anything. So I'll have somebody tell, oh, you should not give sweets to him because he's this, that. I'm like, he's 80 years old. He would rather die eating and enjoying than to increase his years by being sad, not having to eat what he likes to and what he loves to. So, of course, there should be a limitation to what he has. But no, keto diet and all, these are all, marketing strategies. I don't believe in these diets. I'm sorry. I see a question by Tulika Bhattacharya where she says that kindly share what to do when people forget chewing. This is a very important question, and these are again practical solutions that we need to learn. So what we do is, I have this glass with me. So if you have a person with dementia who you have put the food inside the mouth and that person has forgotten to chew, what you need to do sometimes is take the glass of water, and all you need to do is press it in front of the lips. And what that person will do is open the mouth to drink, and you move it. Now, when you move it, the person closes, and sometimes that movement helps them to remember that they have something in their mouth and they need to chew. But that doesn't happen with everyone. Sometimes they will put things in their mouth, will not chew, and put it in their mouth at one side and stay like that. And you keep saying that, finish it. Rather than talking through words, all you need to do is that. Press the water glass in front of the lips, and they will open it to drink. And once they do, you remove the glass, and they will. That's what you do, right? You close your mouth, and whatever is in your mouth, you chew it or you gulp it down. So these are techniques that work sometimes, that does not work. Now, if chewing is a problem that is happening at late stage, then a proper assessment needs to be done. So it's not a one way out. There are various reasons why that person is having difficulty in chewing. So you need to find out what is the reason why that person is having difficulty in chewing.
Okay, I think this is the last question we can take. This is a question by Muhammad Ataul Islam. It comes from core neurological department. Like, what are the differences between Alzheimer's disease, Parkinson disease, and Huntington disease? Are Parkinson disease and Huntington disease threat to same as Alzheimer's disease?
Would you like to answer, or would you want me to answer?
I think the chair can also take this question.
Yeah, let me answer this question. What are the differences between Alzheimer's disease, Parkinson disease, and Huntington disease? Alzheimer's disease, the basic pathophysiology is the entanglement of certain proteins called tau proteins or base proteins. They get deposited in the cells and cause dysfunction of the neural cells. What happens in Parkinson's disease, they are in the basal ganglia. There is an area called basal ganglia where the neurotransmitter called dopamine, the concentration of dopamine gets reduced. So the pathophysiology is different. And Huntington disease is another type of dementic disease where we have some chorea, some abnormal movement called Huntington's chorea. So these all three diseases are basically different, not a single disease. Alzheimer's disease that happens in the elderly. Parkinson's disease can also happen in the elderly, but it can happen in the late middle age. Huntington's disease can happen at any age, from childhood to middle age to elderly. The second part of the question, are Parkinson's disease and Huntington disease threat to same as Alzheimer's disease? The answer is no. Parkinson's disease, if we can treat properly with certain drugs called dopamine agonists, then the response is excellent. Regarding Alzheimer's disease, we know we have no definite therapy except few drugs with some investigative purpose. but no definite treatment for Alzheimer's disease. Regarding Huntington's disease, again, it has no definite cure, but we can treat with some drugs with moderate benefit. So Parkinson's disease and Huntington disease are not that much threatful like Alzheimer's disease, as it has no definite treatment. I think you got the answer. Ma'am, you have something to say.
Yeah, so yeah, and like this is what should come from you, and more beautifully than I would be able to explain. But yes, in Parkinson's and the other Huntington's, it's more of movement disorder, whereas Alzheimer's is more of memory disorder, cognition. But as the progression happens, even in Parkinson's, we have seen people with, which we say Parkinsonism, with dementia, PD, which a lot of people with, you have Muhammad Ali, who had Parkinsonism, but he never developed dementia, even later into the disease, and he could well function, as you said, with the drugs and with right kind of therapy. Unfortunately, in our country, therapy does not happen. And if therapy could be well given to people with Parkinsonism, they can function really well for a long period of time. And the medicine that you said really works well. But unfortunately, in Alzheimer's, the graph is very steep. The medicines can only be effective sometimes in the early stages, but as the disease progresses, the medicines are not that effective.
Okay, Ranadesh Chaudhary has asked another question: whether taking only vegetarian food will make the chances of dementia more?
No, there is no such research that says that a vegetarian person develops dementia and a non-veg person who has fish and meat and does not develop dementia. You see, it's there are no direct link with that kind of there's no research done. But yes, like if you say turmeric, that is good for your brain. We know that age-old Hindu from our ancient Indian stories that turmeric has been very helpful. But in terms of, I am not sure if there's any research on vegetarian food being increasing the chances of developing dementia. I am not, I don't know if you can support that.
One comment from my side. I think what Mr. Chaudhary wanted to connect with vegetarian food and dementia is that probably vitamin B12 deficiency. If someone is purely vegetarian, then vitamin B12 deficiency may be there, and somehow that may be linked to dementia in the later on life. But again, that is reversible dementia. If we can replace vitamin B12, then this dementia will disappear and patient will improve.
Absolutely.
I think by that way it may be linked with dementia.
Yes, I guess that's what he meant probably. Yes. Yeah, thank you.
Okay, this is the last question because I have a curious mind and I had read up on these things before coming to this lecture. Can fart gas of family members or partners help in dealing with dementia?
Wow, I have never had that question in my 26 years of life. I need to really work on that and find out if that really, I don't know, maybe it carries memories, right? I remember my father, he would have jokes around farts. And then, in our family get-togethers, when somebody would fart, immediately it would bring back memories. And so maybe, it could trigger memories of the person who is having dementia. If that person smells the fart and could, remember his father or his mother. This is an interesting question. I would like to really explore this more. But yeah, you never know. This is a new way of really seeing things. And as I said, there is no right and wrong answer in dementia. And you putting this question has really proved that your creativity, there is no stop to your creativity. You can be creative and even try this out. Thank you for this question.
Okay, now I would like base member to present the vote of thanks.
So I would request Farhana Sams to deliver formal vote of thanks. So Farhana, it's over to you.
Thank you, sir. Good evening, Assalamu alaikum, and namaskar to all of you present here. We have came to the end of today's lecture. I am Farhana Shams. On behalf of BASE, it's my privilege to deliver the vote of thanks. So, first of all, my sincere gratitude go to today's speaker, Ms. Nilanjana Maulik, National Coordinator, ARDSI, and also the Secretary General of ARDSI, Calcutta Chapter, for her fascinating, insightful lecture. And I'm sure this lecture will be very helpful for all of us. So thank you so much, ma'am. I would also like to thank Dr. Sheikh Hamadur Rahman for his wonderful moderation of today's session. Thank you so much, sir. And also my heartfelt thanks goes to BASE President, Vice President, GS and all other members for their support. And at last but not the least, my sincere thanks go to our esteemed and lovely audience. Thank you to all once again.
Thank you. Thank you so much for having me. Thank you.
Thank you, ma'am, and also thank you, sir.
Welcome. Thanks a lot.
So tomorrow we have another lecture, the same time, 7 p.m. So stay with us, stay with BASE. Thank you.
Thank you. Thank you.
Thank you all.